This is March 31st, 2020. I'm at Mass General Hospital in Boston to take a look and see what kind of activities we're having for the coronavirus. Patients coming in, ambulances coming in, lines of testing, all of that the media is constantly telling us about. I'm looking over at a spot where the ambulances normally pull in, and as you can see, there's a building called the Lunder building, and it says emergency on the pillars, and there are no ambulances whatsoever. There's a couple of people down below that are intaking people driving up, and we're going to go take a walk down there and maybe talk to one of those people surreptitiously and see what they have to say. So all right, March 31st, 2020, Mass General Hospital in Boston. Take a look at, see what's going on here. Taxis lined up. No ambulances and very little car traffic. Normally, this area here is a traffic jam. People have to struggle and walk across the street here. So I'm going to walk up to one of these guys here and ask them about coronavirus. Got to go undercover now. Hope you can still hear me. Try to speak up. Hey, how you doing? Hey, do you know where I would take somebody to get tested to see? An emergency room right over there? Yeah. So I just walk in, bring them right there, and yeah. Okay. All right. Thank you. Do I have to have a mask to go in, or?
Yeah. So are you from here?
Well, I have somebody I wanted to bring here to get tested, and I just wanted to know where to go.
Yeah. So you could pull up here. You could drop that person off. You're gonna have to come alone because we have a no visitor policy.
Okay.
So they can go straight into that main entrance of the emergency department right there.
Which says emergency with the orange things. I have to go around the orange.
Yeah.
All right.
Park right here. You can take a mask right there. We have them at the front desk also. So
okay.
Yep. And then we'll go in.
Is there a long wait or?
No, not usually. There's clinics all over. If I were you, before you get a test, have you talked to your primary care doctor for the patient?
He has, yes.
And they said to go to
the symptoms seem, consistent with potentially, yeah.
Okay, because I know there's clinics all over the place. Like the Charles River Plaza right on Cambridge Street right there. That has a clinic over there. I think 75, right? And then there's the Yawkey building has a clinic on the 4th floor.
675.
175 Cambridge Street.
175 Cambridge.
So
that might be easier than this.
Yeah.
All right, sweet. Thank you.
Exactly.
All right. Yeah, bye. So, apparently 175 Cambridge Street. So we're going to go over there and see, because there's absolutely nothing going on here. So this is the emergency room entrance where you go for testing at the Mass General Hospital. And not one ambulance. Not one patient, no lines. at all. And there's a good reason for that, because there is no real coronavirus. It's just a normal, everyday flu. Happens every year. Mild symptoms, 3 to 6 days, you're good without any further treatment. And this is being whipped up all out of proportion to cover the financial collapse that's happening, so they don't have to be held responsible for the inevitable collapse. I could probably stand here for hours. A few cars driving by, people driving up. Generally speaking, these cars driving up have a patient that's being discharged. They're coming to pick them up. That's been my experience now. Been here 2 days in a row, and it's been the same, although today it's zero. At least I had a couple ambulances sitting here the other day, but not today. Unbelievable. I could walk up in there, but I don't think I will. It's obvious there's nothing going on in the biggest, most robust hospital in Massachusetts, the flagship hospital, Massachusetts General Hospital. All right, I'm leaving. March 31st, 2020, Mass General Hospital, Boston, Mass. Looking for coronavirus testing patients coming here for the because they have symptoms. We're already taking a look at this. There's nothing going on. This place is as dead as a doornail. It's almost like this place is shut down. No traffic. This is always jammed with traffic. And here we have the people checking in. Right here where it says emergency, and you see that orange and silver barrier, that's where the patients would go. And there is nobody, not one person. So take a quick ride around the building. There's no ambulances, no patients. It's like a ghost hospital. So we're going to circle to our right. There's several other buildings besides the main building. But they don't go there. They don't go there. The patients don't go in that way, but we're going to just take a look anyway. There's always ambulances here, and usually they're coming and going. You hear sirens all day long. Traffic here is usually absolutely at a standstill. And today, nothing. And every day, I was here several days. This place is a ghost town. Why is that? We're gonna see a few ambulances here. They just park and shut down here. This is the Cox building, the Gary building. And here's the Partners Vans Inter-Hospital Transportation employees grab these things and go from point to point for free. Partners is a series of hospitals that are all affiliated, Mass General being the king of all of them, the biggest. And there's, I think, 12 or 14 affiliated hospitals in the Partners group. But as you can see, no stretchers, no patients, no lines of people waiting for testing, trying to get admission. Pretty much nothing. So we have circled the block of Mass General, coming back around to the emergency area where we started out from. And to our right is the emergency input, entrance, excuse me. And everybody's just waiting, standing around waiting for the crowds that aren't showing up. They gave a pandemic and nobody came. All right, we're gonna shut this down and go to another location, see if we can see a little more activity. March 31st, 2020, Boston, Mass. 175 Cambridge Street, supposedly one of the coronavirus testing facilities. I'm gonna take a walk over there and see how many people are here for testing for their coronavirus symptoms. RIC 175 testing entrance through Cambridge Street entrance only. So let's take a walk over there. So apparently you have to ring the bell in order to get access. We have a couple of ambulances outside the entrance sitting here, and somebody in a gown that looks like they're here for possibly So there's the entrance, 175 Cambridge Street, lobby closed, RIC clinic only, and you've got to ring the bell and somebody will let you in and ask you what you want. And you tell them that you want to see if you have the deadly, dreaded pandemic coronavirus. And they'll bring you in and test you up, charge you $25,000 or whatever the hell it costs, and send you on your way. So maybe we should just stand here for a while. This is 4 o'clock in the afternoon. It's not too late in the day. But this street, at this time of a midweek day, is it's like somebody took all the people away, whisked them off to another planet. This is always bumper to bumper, most all day long, with pedestrians attempting to cross the street, people attempting to take turns. This is nothing. I've never seen anything like this. I mean, ever. I've lived here for 30 years. So, here we go. Yeah, I don't know what exactly is going on, but I got the door open. Obviously, those are not people coming here for testing. Wow. Amazing. Walk across the street that you could never walk across during a regular day. You get run over faster than you can whistle Dixie. Nice all-star pizza bar, closed. Pandemic. And there we are. This is a testing facility that Mass General Hospital personnel recommended as an alternate site to Mass General for testing. I guess nobody got the message. Folks, this is all a hoax. The ambulance drivers don't know it. The people doing the testing don't know it. Even the doctors don't really know it. It's being done from up above to paralyze our economy, to ensure that it collapses. And they can point to the fact that the coronavirus caused it to collapse, so they can get away with their ill-gotten gains and their destruction of the economy they did without anybody knowing about it. But not if I can help it. Not if I can help it. And there's millions of people out there like me that have woken up to this situation and are doing their damnedest to let everybody know. I don't think we can stop this collapse. This is going to be a brutal, we have no idea what's going to happen. But it's the first time ever such a major collapse. Now, this is going to make 1929 look like a birthday party. But at least you can't stop it. At least people are going to know that it's not this bullshit coronavirus that did it. It's the banksters and the fraudsters and the psychopaths running all these nations out there that have hollowed out all of our economies for their own personal gain. Their incredible greed, sickening greed, beyond anything ever. I'm going to take a peek in the window. There's What the hell? So you come to the door. And somebody comes to greet you and check you in. They're so busy, he was instantly all over me, yelling at me down the street. Sir, here they come. Hard to believe they're following me into the parking lot.
They opened the door after you left.
Oh, that's okay, thank you.
Oh, after you, okay.
Yeah. No, I'm all set, thank you very much. God, I'm talking backwards into the phone. This is too funny.